Cormagat, Acting Chair. I want to begin my remarks by acknowledging World AIDS Day, as the Minister has done. I want us to remember and also to celebrate all of the people who were claimed by the disease, more than 35 million people who have died from AIDS-related illnesses since the beginning of the epidemic. And I want to grieve and celebrate all of the lives claimed by the disease. I want to acknowledge the emotional cost to so many who survived and who dodged the virus, as they watched, as they counted and as they had to stop counting the sheer number of their friends and chosen family who were claimed by the disease. I was in Éireann on World AIDS Day in 2017 when Michael D. Higgins said, and I quote, "Those who suffered the most in the 1980s were those exposed not only to prejudice born of the misunderstanding of HIV and AIDS, but also to other forms of social oppression, which were and are too often manifested in our society." So many of the people that I'm proud to stand here and remember fought so incredibly hard for many of the services that we have today. They fought so incredibly hard for the right to live free from the church and the state. And as I said, the right to access services like the one I've asked you to make a statement on today. These types of services are incredibly important. Last year, I understand that there were 536 new cases of HIV in Ireland, according to HIV Ireland, the organisation. Men who have sex with men are the group most affected by HIV in Ireland, accounted for 56% of diagnosis in 2018. And yet, the Gay Men's Health Service, which I've asked you today to make a statement on, is the only sexual health service in the country which has not reopened. The sexual health services that I know you will talk about that are open are oversubscribed. And I think the closure of GMHS will have an impact on HIV and STI transmission, and that this will disproportionately affect gay and bisexual men. So I'm here to plead with you today to do anything you can to help the GMHS reopen as a matter of priority. And it's not just me saying this. Between 15 and 20 LGBT organisations have written to the HSE and have launched a petition online. So I think I'll allow you to make a statement on the matter, and maybe I'll come in with some questions that maybe if you can't answer now, maybe the department would write to me. Thanks, Chair.
Thank you, Senator Warfield. I'd like to thank you for raising this issue, and I am aware of the petition that is being signed, and sexual health is a priority for the Department of Health, and this is evidenced by the publication of the National Sexual Health Strategy 2015, as I said before, to 2020, the first major strategy to tackle this vital area. We have made good progress with the implementation of the strategy since 2015, and the Department of Health, along with the HSE, Sexual Health and Crisis Pregnancy, have worked hard to build important partnerships with a range of community and voluntary groups, all of whom are working with us to implement and progress a range of important sexual health initiatives. One area of concerns continues to be the rise in new diagnoses of HIV and other sexually transmitted infections. Last year saw the launch of a number of major actions to combat these rising rates of infections. These actions include Ireland joining the HIV Fast Track Cities initiatives, which includes enhanced access to HIV testing and the rollout of a national HIV PrEP programme, which involves the preemptive use of low-dose antiretroviral medication to prevent HIV infection. The COVID-19 pandemic has led to unprecedented interruptions to the normal healthcare activities, with most services affected, including STI clinics. Virtual clinics are being deployed where possible, with attendance in person limited to appointment only. Service restrictions are predominantly due to social distancing requirements. Waiting rooms can now only hold a fraction of patients compared to before the pandemic, and priority is being given to those with symptoms or requiring testing and treatment. I am advised by the HSE and community health organisations 6 that closure of the Gay Men's Health Services relates to the necessary redeployment of personnel to COVID-19 testing and contract tracing. Work is ongoing with other services, stakeholders and community groups in order to provide the best possible service to GMHS service users under circumstances. An agreement has been reached with St James's Hospital Genitourinary Infectious Disease Clinic, or GUIDE, that all GMHS press users will be facilitated there for follow-up appointments. Phone lines and the GMHS website and other resources such as man-to-man and sexual wellbeing .ie are regularly updated to reflect current service delivery and to signpost users to the HSE list of approved PrEP services. And at a national level, the HSE advised that staff recruitment is ongoing with regard to the dedicated provision of COVID-19 services, and it is envisaged that they will enable staff redeploy to COVID-19 related duties from other health services, including GMHS, to return to their respective positions and resume service delivery as soon as the circumstances permit.
Thanks, Cahir. Look, I hope you'll appreciate that the HSE have been talking about staff recruitment for a long time. You know, what I would ask, and perhaps you can write to me on this, is who's responsible? Is it senior management in the HSE, or is it Local Area 6 that's responsible for the Gay Men's Health Service reopening? Are they committed to its prioritisation, the prioritisation of its return? And you know, what is the actual update on COVID-19 recruitment? You know, when will they be hired? When will GMH staff be freed up and the service reopened? And will they be a priority when staff for COVID-19 are hired?
Thank you. I would like to highlight in more detail some of my departments and the HSE's recent actions with regard to tackling HIV infection. The most significant development in 2019 was the introduction of a national programme of HIV PrEP, which involves the preemptive use of antiretroviral medication to prevent HIV infection, with holistic prevention services which includes regular monitoring and testing, as well as advice and counselling on safer sex practices. And funding of €5.4 million was provided in 2020 to allow the full national rollout and fund additional staff and other resources required to provide HIV PrEP within a broader sexual health and HIV prevention programme. There are landmark programmes and welcome additions to our work in reducing the number of people who contract HIV in future. And in closing, I would like to reiterate our intention to reopen the Gay Men's Health Service as soon as COVID-19 circumstances permit. We are in the middle of a pandemic, and I appreciate that people are anxious to get these services open as quickly as possible. And I know from the staff within the Department of Health and the HSE, they are anxious to do this as quickly as possible. And again, I'd like to thank you, Senator Warfield, for raising this very, very important issue. Thank you.